It's hard enough to ask for help when you are struggling with your mental health. But for thousands of people who end up in inpatient mental health care centers in the state every year, the help can end up being even more traumatizing, particularly when restraints come into play. They are supposed to be used only in cases of emergency, and the State Department of Mental Health shared a goal of eliminating the practice altogether in 2007. But as GBH News' Alexi Cohen learned, the use of restraints has only risen over the past few years, spiking to more than 9,000 cases in inpatient healthcare centers in Massachusetts last year. Alexi joins me now to discuss this. It's incredible that the cases have risen, even though there's a goal of eliminating them that is, almost 20 years old.
Right, exactly. That was something I found to just be one of the most important points of the story. I saw that philosophy statement on the Department of Mental Health website and noticed that it was published there in 2007. And so, I just immediately thought, well, let's see what's gone on with the rates. And even though some years had kind of stayed the same, I mean, in 2018, 2019, they were all around like 8,000 restraints a year, more or less. So I was thinking to myself, well, the restraints have stayed the same. They have not gone down. And then I saw this large spike that happened in 2022. So clearly the goal needs some more work.
We were speaking off camera about how this can really make folks not even want to seek the health care that they need, which could have devastating outcomes.
Yeah, that was one of the most striking things that I had learned from a lot of the sources I spoke to, and especially a lot of sources that I spoke to that didn't even make the story. As you know, Crystal, we talked to so many people who don't even end up making the final cut. But they had said that they were so traumatized or disturbed from being restrained in the hospital that during future crises, they didn't want to go back to get the help that they really needed. So you wonder, what happens to those folks?
And this is a really difficult balance between making sure that people don't hurt themselves, according to healthcare providers, but also folks who will know that this could have lasting impacts in terms of the trauma that they experience while they're restrained. How do you think that that line is being walked right now?
It's a really tough line to walk, and what makes it even harder to walk is staffing issues. A lot of my sources told me that a lot of times patients will not get their basic needs met because the nurses and the staff are so busy, and that causes them to become further agitated as time goes on, where they might just want something really simple and it's not being fulfilled. But you do have to walk that line because the safety of patients, the safety of staff is obviously really crucial. And if somebody is in danger of harming themselves or others, the law says this is the time that you can use a restraint. But I think sometimes it's very hard to walk that line safely, but also without causing undue harm to the patient.
Was there any story or account that you got that was really striking to you?
I mean, I think the most striking account I got was the main source in my story, Jess Thompson. She was a very young woman who was taken to South Shore Hospital by ambulance on a section, and she pretty much didn't really understand what was going on. She is a yoga teacher. She has a regular job. She told me she wanted to leave the hospital. She had a yoga class to teach at 6 p.m. that evening, and so she basically calmly told the staff, I don't want to be here. I want to leave. I'm okay. She got up to walk towards the door and was immediately restrained. She was, taken down by several staffers at once, and it was extremely traumatizing for her. She told me that she has around 50 flashbacks a day. She can't receive tight hugs because she feels as though she's in the restraint. It's hard for her to lay down on her back. She will go out of her way to avoid driving past the hospital if she has somewhere to be. So it really impacted her life significantly, and it was an extremely compelling story, and I'm so grateful to her for sharing it with me, and it was very hard for her to do.
I'm sure. And in the last, 30 seconds that we have here, I mean, what's being done to address this particular issue? Because it's something I hadn't ever heard about.
Right, so there are a lot of potential solutions that I learned about from my sources. One thing is the implementation of an individual crisis prevention plan. So when you check into the hospital, this is a plan that staff can create for you and are actually mandated to do so. And it has to include your medical information, any sort of triggers that you may have, how you would prefer to be restrained if it happens, and things that can calm you down if you become upset and agitated. If that plan is in place, we can prevent a lot of restraints that'll happen by just following that plan.
Alexi Cohan, thank you so much.
Thanks for having me.